Right, you've had a scan, it said you've torn your ACL. What does it mean for you heading forward? Can be a pretty daunting 3 letters for especially athletes or anyone in general. Always puts in your mind, lengthy rehab process, maybe you won't get back to playing sport. We're here to make you, one, feel better and help you understand what the journey is going to look like for you. So let's start explaining what the ACL is. So we've got our friend the knee here. We're going to venture inside, move the patella out of the way, and we're going to look at this little guy in here. This is your ACL, or your anterior cruciate ligament. You've got your posterior cruciate ligament, but we'll worry about that later. What this stops is your knee translating forward on itself, which is why you've probably seen the test where they pull this way on the side of the footy field, and then either it says a yes or a no, and people get pretty upset about it, but can be a bit of a traumatic time and can cause some instability if it's not there. But we can also treat it conservatively with non-surgical approaches, which is getting everything really, really strong. So strengthening your quads, hamstrings, glutes, calves, working on your jumping, landing pattern, running pattern. And there's very strong level research showing that you can still get back to playing high level sport without the surgical approach. Now here in Australia, we most commonly do use the surgical approach. I've had one myself. And how it works is they take the old ACL out, which is probably going to look like a bit of a shoestring, bit of a mess in there. They either use your patella tendon, they use your quads tendon, or they use one of your hamstrings to recreate that ACL. So they pull it out, wrap it all up, make it tight, so it's the same length as this ACL in here, and they put it back in by putting a hole in your tibia and a hole in your femur, pushing it through, putting a couple of little bone screws, a couple of little buttons in there, fixing them together, making sure it's nice and tight, making sure the knee can still do everything it needs to do. And then you come out, start your rehab, can be 9 to 12 months, and then you should be back ready to rock and roll. Now, it's a pretty long process, but for most people, with a degree of instability you can have from an ACL, it's probably recommended. However, in certain people, the conservative treatment can also be pretty useful. So let us know if you have any questions about ACL ruptures, if you've had one yourself, and we can chat about it in the comments. Cheers.